I'm Dr. Bernous, though many people know me simply as Dr. B or Dr. Beebe. Today I'm excited to welcome Dr. Farhad Nikoo to the podcast. Dr. Nikoo is a dual board-certified psychiatric mental health and family nurse practitioner and the lead clinician and partner at Alliance Psychiatric Group. He provides comprehensive psychiatric care for children, adolescents, and adults, treating a wide range of conditions, including anxiety, depression, ADHD, autism spectrum disorder, bipolar disorder, schizophrenia, and also addiction. With experience spanning emergency medicine, primary care, psychiatry, and addiction treatment, Dr. Nikoo brings a broad clinical perspective to mental health care. He's passionate about treating the whole person, recognizing the close connection between physical and mental health. His approach combines evidence-based medication management with psychotherapy, emphasizing personalized care and the lowest effective medication dose to help patients achieve lasting stability and improved quality of life. Dr. Nikoo, welcome to our podcast.
Thank you for having me.
Absolutely, it's a pleasure. So without further ado, as we were talking before this recording, I really like for you to tell us more about what's relevant these days in your line of work and what do you see important for people to be more aware of?
I think, first of all, thank you for having me and creating these podcasts to provide some accurate information to average public to understand what is mental health and what are we doing, and so people can look for help. I think nowadays it's much better than when it was years ago. I remember almost 30 years ago when I was still new here, and the back of the insurance card says mental health coverage is not included, and addiction medicine. And I was like, what is that supposed to mean? And I found out if you want to see a psychiatrist, it's cash-based, it's a luxury treatment, just for the people who had the money, but not for average person. We're having difficulties with the barriers to access the care. We still have difficulties with the lack of knowledge of average person to come and get help. And even among the healthcare providers, they still need to be more educated. What are these issues? What's the pain and suffering of people going through depression, anxiety, bipolar, ADHD, no matter what it is? They're all medical issues. There's no difference between hypertension, diabetes, depression, anxiety, seizure, or migraine headaches. There are some form of medical issues. It comes from our body. We need to learn how to deal with it. It is a medication, psychotherapy, whatever the treatment plan is, but we need to recognize that these are medical conditions. Still, the insurance companies, they treat mental health separate from the medical issues. I've been in healthcare for almost 30 years, and I work in different areas, intensive care unit, emergency medicine, family practice, and I decided to go to field of mental health because of the challenges that we were seeing. And I said, let me get into it and see what it is and learn about it. And my view is completely changed as a person who has been in the field for so many years, but for the past 11 years that I'm treating these people, sitting down with them, talking to them, looking at the mental health issues that's happening and how much we missed for so many years. And now we are learning more and more. We're coming up with the better medications, better treatment plans. It's just getting these things to become recognized like anything else. You can go and say, I have diabetes and get treatment. But when you want to get treatment for the depression, there's so much pushback from average person, even from the healthcare providers sometimes.
And I think that's very important what you're mentioning, and as we were talking about it, the stigma that you see a lot of people that we see and work with people, they come in with depression, severe depression or bipolar or whatever issues, and we tell them, look, you need to get help and see someone to get medication, they are so resistant to it. No, no, no. But they're okay about taking medication for blood pressure. But when it comes to depression or anxiety, they're very resistant because there is still a lot of stigma
Correct.
attached to it. And I'm sure you get a lot of convincing to do when
Yes.
you work with people, right?
Yes.
And I hear that you're really good at it.
Thank you. Thank you. I try my best.
Because you're amongst the very few, what I'm hearing, when people come and see you, from among the very few that you really take your time, spend time with people, try to see them where they are at, talk to them, and really convince them in a healthy way that this is good for you to take it. But
Correct.
I think still difficult, isn't it?
It is very difficult. I think the first session is the most important session, not just in psychiatric field, in any field when you're working. I always tell my students, you walk into the room, you left the room, if you convince the patient regarding your treatment plan, you finish the treatment. If you walked out of the room, the patient did not trust you, did not trust your treatment plan, even though you provide the best care, it's not going to be effective. Example, work in emergency room. People will come in all the time and insisting to get a Z-Pack, azithromycin, with an antibiotics for bacterial infections. And I spend time to them to explain, you have a flu or you have a cold. You can take some Dayquil, NyQuil, give it a few days until you improve, rest at home. But people will resist that. They were insisting, I have to work, give me the Z-Pack and some cough meds with codeine, I'm out the door. It could have been 5 minutes visit for me, and I'll move to the next patient. But I spent half an hour explaining, and sometimes I printed the prescription, give it to their hands, says, trust me. If it was the Z-Pack was the cure, we would be all of us in the ER taking Z-Packs every day. We get sick like you too. So that Z-Pack is not going to resolve it. But this is the prescription. If it gives you peace of mind, try 2 days, rest, some Dayquil, NyQuil. Unfortunately, you have to miss work. And if you did not get better, here you go. Help yourself. Many, many times I've seen the same patients coming back say, you know what, I never used that Z-Pack. Thank you for letting me know. Now I know what to do. I wait this period of time. If I'm not better or if this happened, I'll come and get help. With the mental health, like anything else, what I normally do, I try to get their full history, their backgrounds. Do they have any medical issues? You give a good example, hypertension, cardiac disease, autoimmune disease, eczema, psoriasis. Thyroid issues. If they're not seeing any doctors, and you'll be surprised how many people they haven't seen anybody, they just feel these symptoms, they come in, which is good, at least they come to get help. And we run some labs and we ask some questions, we find out it could be like you mentioned, if your thyroid is not working well. So you might have hypothyroidism, symptoms of depression, you treat that, problem is solved. Or it could be your thyroid has some issues, like the example of the hypertension. A lot of people with anxiety, they do tend to have higher blood pressure and their pulse is faster because they're constantly on the fight and flight mode. Their sympathetic nervous system is activated and these neurotransmitters are being released and their heart is racing. And you see it all the time. I've been to the ER. They said, you don't have a heart attack. You just have panic attacks. Yes, go see a therapist, go see a psychiatrist. Or like when I work in the emergency room, I'll see, like I remember one guy, he used to come very young. Every week he was in the emergency room. The problem was with him, complaint was chest pain, I'm having a heart attack. And as usual in the emergency room, you run all the blood work, you have to do CT scans if needed, do the cardiac workup, making sure it doesn't have any heart issues, there's no blood clot. It might be your unlucky day, that day that he comes in, he really had a heart attack. So you have to do your workup. You can't say directly it's a panic attack. But at the end, we did 0.5 milligram of Xanax. You took care of that, chest pain is gone. But he refused to get help psychiatrically. He will come to the ER. And that was actually one of my motivations that I was just like, why is he not seeing someone? And he said like, oh, I tried, there's no appointments. I couldn't find anybody. I saw one person one time. I didn't like the guy. I said, it doesn't matter if you like the guy. You should go and seek help. He's not good. go see someone else.
But see, what you're saying is very important. I think it's an indication. People rather have medical condition than mental.
They're
See,
wrong.
I rather have a heart problem. I'm okay with it. I can openly talk about it, but I'm having shame to talk about I have panic attacks.
Correct.
So there is that preference.
That's correct. And people don't understand these are medical problems. And I think the insurance companies should recognize that too. We're doing much better than what it was 15, 20 years ago even. These are not different than anything else. Where is the mental health problems are coming from? It's coming from our brain, our nervous system, overreaction of your nervous system to whatever the stimulation is. Me and you driving the freeway all the time, we're fine. And somebody gets into a car accident and he cannot drive anymore. Every time he sits in the car, he's not the driver and having panic attack, chest pain. Why is that happening? It's something coming from his nervous system. So like any other medical conditions, these needs to be treated. It doesn't matter what the treatment is going to be. It could be just therapy. If that resolves it, which is the first step always, if that didn't resolve it and the amount of the response to that, the stimulation, whatever is coming is exaggerated and we cannot calm it down. And sometimes temporary medication can resolve it too. But there is no difference. I always explain to people, when you have a migraine headaches, you do MRI, you do EEG, everything is normal. Where is it coming from then? That's a pain, right? It's in your head. But the same brain can also have depression. It can be sometimes even for no reason. And you know, you're an expert. Part of our assessment is always family history. We ask them, has there been a family history of any mental health problems?
Yeah. Or trauma.
Or traumas,
Yeah.
or different things. All of these can accumulate, and your body's response can be more than average person. And that is no different than any other medical issues. I have numerous patients that treated for anxiety. I actually have a couple right now that they were like giving blood pressure medication left and right, 3, 4 blood pressure medication. Still the blood pressure is not coming down. Why is it not coming down? Everything is working, labs are normal, taking the blood pressure medication, the person is not obese and trying to be active, trying to eat healthy, no salt. But the Zoloft treated their blood pressure. How is that possible? Zoloft is not antihypertensive.
Yeah.
You bring down the anxiety and their sympathetic nervous system calms down, their brain calms down, and their blood pressure is controlled.
Speaking of this medications for anxiety, you know, one of the issues that most people have is the fear of getting dependent on the medications. And obviously we have different types of medications. Some
Right.
of them are habit forming, some of them are not. So do you see that also be part of you and your dialogue with your patients regarding the fear of addiction that they have about psychotropic medications?
Absolutely. My explanation for them is, number one, we don't know how long they're going to be on a medication. It could be, usually we try to treat them like around 9 to 12 months until they're stable, then we will wean them off. If it's the first time, you come to me and you say, you know what, this anxiety started after my business went down, I went bankrupt, and I can't sleep, ruminating thoughts, depression, anxiety, all these things, never had any issues in your life. You might be treated for 6 months even. Things are better, we can wean you off. There are different kind of medications for any medical condition. Let me give you an example of non-psychiatric condition. You come in with asthma. If your asthma is exercise-induced, or every time you get sick, you get cold, you start wheezing, you start coughing, we give you an inhaler. You use it as needed. That's called a rescue medication. But if you come every week to my office and ask me, can you refill my inhaler? Can you refill my inhaler? And I'm going to ask you, Dr. Bernous, how many times a day you're using that inhaler? Well, 6 times a day. And what about at night? Oh, all night. Okay, so you've been using that inhaler all the time just to open up your lungs temporary and goes back to what it was before. And asthma is another condition, like with our patients with mental health issues, they can have their asthma exacerbation because of anxiety sometimes.
Yeah, absolutely.
So if that person is using that rescue medication all the time, it's not an addictive medication. It's opening his lungs, but the effect is so short. Then we change our treatment plan. We put you an inhaler that is going to keep your lungs open, reduce the inflammation because it's a chronic inflammatory disease. So you don't need the rescue inhaler all the time. And every time you come, we listen to your lungs, which could be clear at that moment, but in the middle of the night, you wake up with a cough. We will ask you, how many times did you have to use your rescue inhaler within the past 1 month? And based on that, you decide, how am I going to adjust my treatment plan? It's the same concept in mental health. And again, in my opinion, mental health are neurological disorders. It is coming from our nervous system. The treatment is like any other part of your body. I've treated so many different medical conditions. And contrary to what people think, they are not addictive medication. It depends. We use different kind of meds. I always say anything comes short and comes fast, goes away fast. We use, let's say, benzos.
Exactly.
They are the addictive ones. But it doesn't mean if you took Xanax 2 times a month, you're going to be addicted to it. When you come in the first few days that we are starting the treatment to get you stable, we might need to give you something to calm down that anxiety, bring it down, until the medication, your maintenance drug, it's going to settle on your system and it starts working. Because as you know, most of the drugs that we use that we consider safer, like SSRI, SNRIs.
But benzos are habit forming.
Benzos are habit forming. If you use it frequently, which people think using a Xanax actually better than using a Zoloft.
Really?
Many people. Say, all my life, I've been taking only 1 milligram, for example, or 2 milligrams.
Every night, yeah, for 20 years. I've seen that.
Yes. So those are the challenging ones that they're trying to convince them that this medication, because it doesn't matter what medication you use, at the end of the day, we have to treat your body as a whole. If I give you a pill, it's not going to go just to your brain or just to your stomach. It's going to go everywhere. Let's say if someone comes with diabetes, there are medications that are very effective, but you can't use them in them because you're going to increase the blood sugar. There is risk of hyperlipidemia, the cholesterol goes up. There is risk of obesity, so we have to avoid them. So we have to consider giving a medication to a person is a huge responsibility. It doesn't matter what it is. Even if it's a Tylenol. People think Tylenol is safe because it's over the counter. But I've seen many people are like taking like high dose of Tylenol affected their liver. So if anything...
So you see the same thing. I'm assuming people at times, using more than necessary psychotropic medications. But do you see, the way you're saying it, and I respect that, obviously, you're in the field of medicine. So you're seeing this as a medical and mental health. Your approach is more like a medical look at the mental health issue. And I hear that. So my question is, do you see medication as being a cure for mental health? Or because a lot of, psychiatrists, psychologists believe that medication is only helping with the symptoms, not necessarily curing the underlying issue. If you're talking about trauma, for example, childhood trauma, medication could help prevent the panic attacks, but it's not going to solve the problem unless they go to therapy and resolve the actual trauma by processing it. But my question for you is that if we look at it as a medical condition, then is medication going to cure the PTSD?
No. So it depends what condition we are treating. And of course, for any medical condition, the reason I say medical condition, because that the stigma of the mental health being separated from the rest of the medical conditions, rest of medicine, that should not be, in my opinion, working in the healthcare for so long, it is not acceptable that we do not treat mental health conditions as regular medical conditions. The example is I was treating a person with the bipolar mood disorder. Manic symptoms, psychotic symptoms, treated him took us like a few months to get him stable. As you know, insurance companies respond to you 6 months later, 8 months later, trying to process your claim. And the biller keeps telling me they don't pay for this patient. I said, why not?
Mm-hmm.
She said, they say this medical condition is not covered under the plan. And I was shocked. I said, what do you mean? And she said, I don't know. She kept resubmitting, and then she came back to me and she said, this person's health insurance does not cover a mental condition.
Really?
Yes.
I thought it was mandated.
That was years ago. No, still back then it was separated. And I said, okay, so I have 2 board certifications. I have 2 degrees. You can submit under my other board certification if that's the case. You can say, okay, he saw him in the primary care. Why is it not covered? Because he was seen in a psychiatric office. Of course, we're not going to go after a patient that the insurance didn't pay. We don't feel good about sending people with depression or anxiety to collection agency. I mean, sometimes you have to sacrifice. At the end of the day, me and your job is to help our society, our community. We have heard a lot of good things about you, too. Example of spending your time on the day you're now working to create this awareness for people is we appreciate it. When we say medical condition, I mean, yes, it should come like under anything else. Then it comes to the treatment approach. The treatment approach for every diagnosis is different. When somebody comes in and says, yeah, I'm having panic attack, my chest hurts. Number one, you have to make sure this person doesn't have a heart attack, doesn't have a blood clot, and then what happens? So you spend a lot of time to figure out and have some differential diagnosis. What do you think is the issue is? Then it comes to treatment. The treatment always, number one is lifestyle modifications. Trying all the other remedies except medication. And psychotherapy, it's actually number one. When I see someone comes that has seen a therapist, has seen a psychologist, and they refer them to me, it makes me much more comfortable to treat that person with medication than somebody who's never seen anybody.
That they come directly to you. So let me see if I got what you're saying. I really like the way you're putting this and showing it, because the way I know a lot of people are okay with accepting medical conditions, as we talked about it at the beginning. So the way you're presenting this, I'm assuming, to your patients is also, look, this is like any other medical condition. Don't make it such a big deal.
Nope,
let's just take the medication. Let's go to therapy. Let's do this. So this approach is actually reduces the resistance from your patients, I'm assuming, right?
Yes. So when they come in, it doesn't mean anybody who walks into the office gets a prescription. There are people who don't get a prescription, and they think it's a waste of time.
Yeah?
And yes, and don't get me wrong, not just psychiatric or mental health. Everywhere you work, in primary care, they have every day they see like 20, 30 patients. At least 4 or 5 of them are mad at them because they didn't get a prescription. It's the same thing in our offices too. There are times people come in and I will tell them, you need to start seeing a therapist. You need to do some psychotherapy. And it is always part of the treatment. The best result always comes if you use a medication, even if it's combined with psychotherapy. And especially if you have good experts like yourself, like many other psychologists around here, we really appreciate it. We feel protected.
Yes.
When you guys are on board with us, you're treating, because I know there's a red flag, you're going to reach out to me.
Absolutely.
And which you have done many times. And so when we see, because we cannot rely for everything on medication. Let's say nowadays people are all on Ozempic, Wegovy for weight loss.
And you're having a lot of liabilities as well.
Absolutely.
It's difficult. Now, speaking of medication and the current issues in the mental health area, what do you see beside this, stigma and medication? I see, for example, a lot of people that getting diagnosis of autism, because these days is very popular. People are interested to know more. They come for testing in really late life. I have people in their 50s.
Yes.
They come for testing. And One assumption, the wrong assumption they have is that there is medication for autism. And we try to tell them, look, autism doesn't have any medication. Is if you have anxiety, depression. But do you have the same issue that people come to you with this?
Yes. So autism, I think people talk about why is the autism is becoming more and more. Why is the numbers are increasing? I think part of it is because we have more awareness. Mm-hmm. We have more psychological testing. We are having more early diagnosis. So we can get to help them as soon as possible. The sooner, the better. And it's so broad right now, the way that the descriptions of autism spectrum goes from very minor symptoms to severe symptoms. Mm-hmm. And there is no medication to say that we're going to cure autism. There is none. But so autism, as you know, it depends. What are the symptoms? You nailed it. Actually, you're absolutely right. I come in, I've had that issue too. And sometimes, okay, you want to go and get the testing done, go see Dr. Bernous. Let him do the testing. But I try to explain for them because, and it is very common for us. People come in with a diagnosis in their head. No matter what you say, they're the doctor, they're the psychologist. They have 2 hours of training on ChatGPT, and they're trying to preach you and give you the treatment plan all the time. And they don't like it when you say, I try to explain because it doesn't matter if I give a medication, I don't give a medication. I'm there just to help them. At that moment, my theory is always a person comes in to get help. Forget what's their insurance, who are they. You just try to help them, whatever is the condition they have. So autism has become like a lot of people are coming. It could be just an anxiety they have. They may have behavioral issues all their life. They don't want to accept that they're being angry with people or the anxiety is interfering with their life. They just try to say, I have autism and I want to get help. And said, okay, you can go see a psychologist, get the testing done. But in your case, for example, it's going to be psychotherapy number one. Or give me something. It's like, what do you want me to give you? No, something to get rid of it. It all depends. If the symptoms are not severe enough, even with the kids with severe autism, it all depends what they have. We have ABA, which they're doing a great job. I really appreciate people in that field that they are helping with these kids at the very young age. And the way I like their work, they go at home, they go to their school. They try to provide therapy at a very young age to teach them how to become independent.
Yes.
Because a lot of them, they grow up, they don't know how to deal with other people. The social skills lacks. They can't do their minimum chores. But these people get involved very young age. And this should continue, should not stop at any time. After that, okay, it goes higher level. They need to have a psychologist on board. We all need to work as a team. That's one thing I think we need to work more on it, which has improved significantly. But in my opinion, every psychiatric office should have a psychologist there. Mm-hmm. In my opinion, everybody walks in, the first assessment should be by a psychologist, actually trained psychologist who can do the testing. You see, I will refer you sometimes patients that, not sometimes, a lot actually, because I like that you guys spend more time, do testing on them, ask so many questions, and sit down with them and try to narrow it down. So when they come to me, it's easier because no matter how much I spend time, the more we see them, the more we get to know them, the treatment will be better. But especially in the beginning, knowing that they saw a psychologist, that fear of seeing a therapist, because sometimes when we tell them, go see a therapist.
They're afraid of.
They're afraid of.
I know.
I said, what are you worried about? I don't want to talk about it.
Yeah.
It's okay to talk about it, and you should talk about it. Like you mentioned earlier, PTSD.
But you know, they see the thing is, they look at you, okay, he's a medical doctor, this is a medical condition, it's fine. There is no shame. But then, am I crazy to go see a psychologist? And you know, they even use the term. So, are you going to diagnose me crazy? We keep telling you, there is no such a diagnosis in our DSM.
Yeah, unfortunately, there's a lot of bias about the diagnosis of mental health conditions among the patients, even among the other people around it. It makes it difficult for us for certain conditions to put a diagnosis. And I don't blame them also. Sometimes, let's say, for example, life insurance. If you want to go get a life insurance, and if they found out you took Prozac 20 years ago,
really, they still
deny them. Why? I mean, there is no one that would never, ever need treatment of mental health.
The same is with Department of Defense. I actually do a lot of assessment for Department of Defense because when they want to hire someone for the officers, as an officer, ROTC, if there is any history of in the past that the kid took some medication because somebody died, or even they went to therapy for a short while, they send them to us to get clearance. And I look at it, I say, the guy is 35 years old. When he was 16 and the grandpa passed away, he was sad. He went to therapy for 6 months. Now they want to see if he's able to join or not. Of course. So there is such a thing. And that's why some people are worried about taking medication or going even to therapy.
Absolutely. Unfortunately, yes, those things are huge barriers for people to come and get help because they're afraid that they say, I don't want it to go on my record.
Yeah.
Okay. So as part of our job, we have to put a diagnosis. And when I'm treating somebody with a medication, I should have explanation. Why am I giving this medication? God forbid, there's a side effect, and they will come after you. Why did you give the patient like Abilify? And now he has tardive dyskinesia. Because they had bipolar mood disorder, they had schizophrenia. So at least you have it. And always, anything you want to do, you want to have a goal. You're not just going to throw meds at people because I feel like it. No, there should be a good reasoning behind that when you're treating not only medication, even psychotherapy. They're coming and seeing it, which I think everybody will benefit. You don't have to have a psychiatric diagnosis. Maybe sometimes life is not easy. There are difficult days, good days, bad days, and statistically, you know better than me, every single person, at least one time in their lifetime, they qualify to be on a psychiatric medication based on the criteria DSM-5.
Yeah.
Right?
Absolutely.
Who doesn't become depressed sometimes? Who doesn't get anxiety? It's a normal emotion to feel sad, to feel anxious sometimes. But how long is it going to last and how much is affecting your life? That's the part that we have to see. Is it the anxiety has caused you not to drive on freeways anymore or not driving car anymore because you were in a car accident 2 years ago, you lost your job, you can't take your kids to school, you're just sitting at home all the time, now you're broke, but you refuse to take a Zoloft because that's going to look bad on me.
You know, speaking of schizophrenia and bipolar, as you mentioned, and Abilify, it brought this, issue back into my mind. I wanted to ask you about it. Is that, have you seen lately that because of cannabis being legal and how strong they are these days, that a lot of young people apparently just, starting psychotic episodes just due to the use of cannabis? Have you seen, and you want to elaborate on this?
Many, many times. I used to be a consultant for Providence or Mission Hospital in Laguna Beach for 4 or 5 years. So part of my job was stop in the ER first and do the consults there, and then move to medical floor, ICU, all the floors, and just do the consults for their psychiatric conditions they requested help. So many of them on a psychiatric hold, they had to be evaluated. Sometimes people would just come in voluntarily. They needed to be emergency evaluated. And I've seen many, many, many young people, not only just young, I've seen even older people. They never used marijuana. Now they heard there are some benefits from it, and they came to California and went to a dispensary, bought a bunch of edibles, took it to the hotel. I remember one case, that lady, I can't say the name, but a very famous person, an older lady, she was going through some rough time, and so they found her. She's like, the water is running around, and they broke the door. She's passed out, and they brought her to emergency. She was in psychotic symptoms, as you mentioned, for a few days until she snapped out of it. And they found edibles all over her room. And when she was with it, and I was asking her, why did you take that marijuana? How much did you take? And she started explaining, well, I've never had experience. They said that's going to help with anxiety, and I just came here to relax in California. And I went into dispensary, I bought some. I didn't know how much I can take because these are gummies. They taste good, and why not? So many young people, ages 15, 16, college students, admitted to a psych facility due to acute psychotic symptoms, manic symptoms, mostly marijuana induced. The marijuana right now that we have, fortunately, a lot of them are processed, in my opinion. They're not like the natural weed they used to smoke. Even the weed that they have, they're all genetically modified. They're more potent. And the younger people, they don't have any experience, and they just blindly take it, and before they know it, they're presenting with some form of psychotic symptoms or even bad severe anxiety.
Yeah.
I've had many cases that I had to follow up with them after a discharge, and eventually I got them off medication because they were on antipsychotics. They were on mood stabilizer, and it was all marijuana induced.
Yeah, and I've even seen that one. The good thing is if it's not something serious, usually if they stop it, it goes away.
Correct.
But I've had cases that the person was predisposed to schizophrenia, and one-time use of a wax got the first episode, and then the whole schizophrenia
Showed up.
showed up, and this guy was really, disabled. And the
Right.
danger, I guess maybe there is not enough information, education about the dangers of, using cannabis while dispensaries, I drive to my office, one of the biggest one is off of 55.
Yes,
It's a big
they're everywhere.
one, huge, and you just like, and these days, the interesting thing is now, despite the fact it's not legal, what I hear and I see is that they're also selling mushrooms in dispensaries.
Correct.
And it's just like, okay, so availability and lack of education could make it really dangerous.
Correct. I mean, one of the most common substance used here is alcohol. It's legal. And I always make fun of patients sometimes when they say, I don't want to take medication. I want natural remedies. I say, well, you tried your natural remedies. You've been drinking tequila and smoking weed every night. What are you doing here now? If anxiety was supposed to go away with them. And I wish, I'm open with any natural remedies. If you come and tell me I eat this fruit and it's helping me to calm down, if I drink this tea, I'm all with it. That's number one things. If you can treat things with any medical condition with some natural remedies, of course.
Good.
But when it comes to the pill form, when it comes to process, even over the counter, if you take a vitamin C, you can squeeze a lemon or orange and have vitamin C. But if you take vitamin C pills, that's a pill, in my opinion. Not that there's anything wrong with vitamin C or multivitamins, but distinguishing between natural versus processed. Marijuana, mushrooms, we see a lot of those things in our practices. If, let's say, if you have a genetics, and in my opinion, genetics is a huge part of our assessment. I always try to get the assessment part, the family history, not only psychiatric, cancers. If, let's say, in your family, God forbid, the mom's side, they all had colon cancer, uncle had it, the cousin had it, mom had it, then you have to pay attention to colon cancer. If there's diabetes, runs on both sides of your family, the risk of you getting diabetes is higher. The same thing with the mental health, with schizophrenia, bipolar mood disorders. If you look and ask them, back in the day, nobody was getting help. Most of the time when I asked them, they said, I don't know, but my dad was a very angry person. Okay, that's when my parent got divorced. He would change job to job. He married 3 times. He would beat up my mom. So that person definitely has some mental health issue was going. And so we have to pay attention to those things. But if you have the gene of bipolar or, let's say, schizophrenia, and then you mess up with some form of psychotropic, like, let's say, for example, methamphetamine. That's another one.
Yeah.
That makes you psychotic regardless of what genes. But you wake up the beast, then that's it. You don't know.
Yep.
Like people are asking me about mushrooms nowadays all the time. That's another thing is coming up. I know there are some benefits from it, but it should be in a controlled environment. We know how much we're giving you. Then you just going and swallowing a bunch of mushrooms. I don't know what kind of mushrooms, from whom you got it, and how much psilocybin is in it.
Yep.
And I've
Potency and
seen
everything.
patients with psychotic and manic symptoms with mushrooms too. Even some medications like ketamine, we do the ketamine treatment. the same ketamine can be abused, can be fatal. But when we do it and we're doing it in a controlled environment, we're watching how much dose we are giving you, and we are evaluating monitoring you, making sure you didn't go overboard, it didn't cause any psychotic symptoms, even if it's all off we prescribe. We have to make sure this person is acting normal. One thing, that, especially with our Persian community, we face it all the time. People come in, you see them once, twice, 3 times max, they come in. They expect to be like in Iran or other places that you get a prescription for 2 years, you're going to be on a Zoloft. No, that's not going to happen. We have to monitor because we are giving you a psychotropic that's going to affect the way you think and the way you act. If I feel that the medication it's causing you harm physically, mentally, I'll get you off. And I've had patients, they praise me, oh my God, you cured me, you're such a wonderful doctor, this and that. Then I always say Richard, because Richard was my patient that unfortunately became manic with the Bremeron, 15 milligrams just for sleep. And he was writing me poems coming in, flowers with Richard. I felt like Richard is going overboard. So Richard, we need to stop that medication. But Richard didn't want to stop it. He got mad at me, and from becoming the best doctor ever seen in his life, in the age of 76 or 78, he just went to primary care, got the medication, doubled it up, and he's full-blown manic. So you let it to that. I always tell patients, you know, if I have thyroid issues, I'm going to go to an endocrinologist myself. I know the thyroid treatment, but I let him.
Primary cares don't feel comfortable writing psychotropic medications, but
some do. Yeah, I mean, the primary cares are also, they're good. They see different kind of health conditions, and some of them are very good. They understand it. They, if you work enough with them, I did the primary care, but I will admit that when I went back to school, when I studied it, and when I work, I mean, in the beginning, I was one of those guys I had like these references, and I had like UpToDate.com, all the books in front of me. If anything, I'll see, finding what's the latest guideline, what's the treatment plan is going to be. And usually it's a clear cut. You know, the treatment of hypertension, diabetes, what meds, and usually they work. Well, we run into treatment resistant also too.
But also there is another issue. When somebody's on manic, they like it. They don't want to come off of it. That's the most
manic, yes.
It's the most difficult thing is to convince someone who has bipolar to just take medication because they love the manic. Yes. And then if some of them, as you probably see, they come in, they try to say, I have ADHD because they try to get their hands on some stimulants.
Correct.
And when you test them, you see you don't have ADHD. And I always test them for anxiety, PTSD, and mood disorder. Because a lot of times they are trying to get, and you know, we know that, yes, you could have ADHD, but you also have bipolar.
Correct.
So you can take stimulants, and you have to, your prescriber needs to be aware of it. But this desire of getting themselves into that upper side of the mood, you know.
We want all quick answer to everything. And fortunately, the society, everything should be instant. It's like you're ordering Uber Eats. You want your food to be there, and you want some mood stabilizer. The next day you wake up, the word is, oh, beautiful word. And the reality is not that. And you mentioned a good example of the ADHD. It's another challenge we have, actually. And since COVID, a lot of telehealth has started, and which in some ways it was very good for the mental health field. I feel we were able to provide better care and better access to real people with mental health issues. Because like I had a patient of mine, first time I saw him, and he said, these are the meds I'm taking. Can you please give it to me for 6 months? Don't ask me to come in 3 months. I said, well, I just saw you first time. And you're taking some medications that need to be monitored, but I spent some time talking to him, and so how are you doing now? And he says, that's why I said I don't want to come for 6 months, because I can't sit in the car. When I sit in the car, I have to be in the back of the car, lay down, and my wife or my daughter bring me in. They're working, they're busy, so they don't have time, so I don't want to bother them. That was before COVID. And thankfully, COVID hit. The reason I say thankfully, because the telehealth, In the beginning of the COVID, so everything was a chaos. Actually, I was the only provider in our office that would show up in person. And among our consult team, I was always in a hospital because thought these people deserve to be seen in person if they want to. And you can use precaution. So, and then the list you will look at it, all the patients were canceled because the office, they didn't know that it was everything up in the air. I'll go over the list of my patients that cancel visits. I call them, all of them. How you doing? There's COVID going. Everybody was scared. And I think a month or so. I don't remember how long, 2 months. So I just did it for free. If they call, I took care of them. I mean, part of being a human beings, we help each other. And then they started paying. So awesome. So I was the one who was making most money because I was already seeing patients. So this person during the COVID, I could talk to him every month.
Yeah.
So I could change the treatment plan over the telehealth every month because he had access to me now. He was okay talking to me, but he did not want to come to the office. Eventually he came. I said, I need to see you. You're taking medication that might cause some symptoms of tardive dyskinesia. So you have to come in. So, okay, I'll come in now. But the progress, specifically this case, I always remember the person who told me, don't give him medication for 6 months, don't ask me to come in, became to the point that we actually got rid of some of the meds. We adjusted medications, and he was proud to tell me he can sit in the front and his daughter can bring him in. Or when there is guests at home, he can come and sit in the living room and he walks the dog. A person was not leaving the room. If the guests will come to the house, he will get bad anxiety, gets in the car, gets panic attack. That much progress was made for him. So that was a good thing that we had throughout the COVID, and thank God still we have it. But still there are challenges too for these people to come and get help.
But then again, beside the challenges, I guess another point that we are also addressing is that sometimes there could be some hidden agendas that people come to you and they try to present with some symptoms. As you said, ChatGPT and Google,
Yes.
they know some of the symptoms. They come and say,
Correct.
I have this, and that.
Yes.
And I must be having ADHD, so I need to have some stimulants. You usually send them to us. We test them, and the computer test shows they don't have ADHD. They get mad. They get angry. They say,
Yes.
how dare you? Or some of them, they come and say, I have PTSD. We do assess and say, okay, you do have trauma, but it's not to that level.
Correct.
And they get mad that sometimes they get mad if you give them a diagnosis. Sometimes they get mad if you don't give them a diagnosis.
True. Yeah.
And they sometimes seek medication for the sake of, the pleasure aspect of it.
Correct.
Which you deal with that part a lot, I
Correct.
guess.
Correct.
So how do you usually address that if they come and seek, I'm interested to know your approach, they seek stimulants, but they don't have ADHD, they don't need it.
If you notice, every time I send a patient, I don't like when people come in that they say, oh, this is my TOBA test, I had an ADHD test, I'm positive. Where did you get the testing done? I paid $200. I went to this office, they did it. I have ADHD, I want Adderall, this amount of Adderall, okay. I always, when things, if it is clear cut, it's whatever it is, the medical conditions or mental health condition, you can just go ahead and start the treatment. And sometimes you have to because they really need help, whatever it is, depression, anxiety, ADHD. But I personally, as I was mentioning earlier, I prefer everybody that comes to us to have some psychological evaluation done by some experts like yourself. Get the testing done, not just ADHD.
Yeah.
In my opinion, ADHD, lack of focus and concentration, as you know, it can be with depression, it can be with anxiety, it can be bipolar, it can be numerous of medical conditions. Like you say, I have fever. Is that a flu, cold, UTI? You have cancer? Who knows? So when they come, if you see, I always write on the paper, please get neuropsychiatric evaluation. I want full assessment. Depression, anxiety, ADHD, bipolar, schizophrenia, personality disorders. When they come with their reports, and I love your reporting that always comes, is everything is in detail. If I get them before I see the patient, I read the report, I'm ready to go in, I feel more confident to treat them. If it's ADHD alone, fine, it's okay.
Yeah.
But misunderstanding of the ADHD has to be treated definitely with medication is not true. They can use coping skills. If they will see someone who's a qualified psychotherapist, they can walk them through the steps and they can use it in their advantage. They don't have to be medicated. A lot of kids with ADHD, they grow up, they go off medication. They don't like it. But a lot of people, unfortunately, they're on high-dose Adderall, high-dose benzos. Usually, who are they? They need an upper and they need a downer.
Yeah.
Because their mood is all over the place.
They try to keep it.
They try to balance it with the high-dose Adderall, high-dose benzos. So when they get the testing done, it is you create a roadmap for me that, okay, this is going on, and a lot of times, and you also mentioned mild, moderate therapy recommended or medication may be recommended. So at least it's like doing a full blood work. And I think that should become something routine in psychiatry. Anybody comes in, like we send people for comprehensive labs. If they come first visit, they don't see a primary care, they don't do blood work, they haven't done it for more than a year, I'm going to order it because I want to make sure medically there's no other things
going on.
Because with our body is all connected. Problem in one area, in your heart, in your stomach, in your guts, it can affect other places too. It's the same thing with our brain.
Let me ask you a technical question. A lot of parents, when they come in and when it's clearly established that their child has ADHD and is causing a lot of issues for him or her, and as we know, if it's not treated, it's going to turn into oppositional defiant, then even conduct disorder, complications. But they are so against taking medication. And we, of course, tell them that there are, neurofeedback, other possibilities, but sometimes medication is necessary.
Correct.
They have this misunderstanding that if my child takes medication for ADHD, it's going to stop his growth. And what do you have to say? I think it's important coming from you as we are recording that can we put this and settle this and say that if it's indicated, medically necessary, it's safe for your child to take medication for ADHD?
Again, this is like any other condition. If the symptoms are affecting you, especially with the mental health, it's affecting your quality of life, then it needs to be treated. With kids, I'm not a big advocate of medicating everybody, especially when it comes to kids. I'm very conservative. What I'm going to give them, and I highly educate the parents, how are we going to use these meds? What are the side effects? What to watch? And they have to be in person to see them. I want to keep an eye on the child because I'm protecting that child, not the parents. And they get it wrong. They think because they are the parents, they have the right to decide what is the treatment plan is going to be. You can advocate for your child, you can do, but when you go to some expert, when I take my kids to the doctors, I don't say what I do for a living. I'm just sitting there like anybody else, listen to that doctor who's evaluating pediatrician, my son, and says like, okay, that's the treatment plan. I said, thank you. Then I'll follow that. Or if I don't agree, I don't follow it. When it comes to ADHD, and very good point, if a child, I always have like two main questions at the end of the visit. Is these symptoms of ADHD affecting him in the school? Is his grades are all low? Are the teachers complaining? Because they're with them all the time.
Yeah.
And so many times the teachers are sending them. Are there any behavior issues at school? One is their education, their grades and everything. The other part is the behavior. The child is running around, hitting other kids.
Yeah, taking into trouble. Some of them
Big
give a
time
law.
fights, and I've had kids
Vandalism even.
Yeah, they kicked out of the school. They got kicked out because they were just harming other kids, and I don't blame it. There's one kid that the mom didn't believe in medication, and one day they came in because the child he was expelled from the school. He put a rope around another kid's neck and pulled him, and they were just okay, no more. That's it. So if they need to be treated, if we don't treat them, we're not doing them any favor. We're holding behind. They're not going to be able to finish their education. They're not going to be enjoying like any other kids at school. And this is the stigma about the medications. There are different kind of meds we use. And every medication has its own benefit and its own side effects. Even the water you drink. We need it every day. We drink too
I
much
gave
water.
you good water today.
You did, yeah.
There's no side effect in this water that we are
Yeah,
drinking.
you drink too much water, your sodium is going to drop. I have one case that he has severe autism, you mentioned. So he's older now, he's 65, but he drinks so much water, the
yeah.
sodium drops. We
Drops
have
so
to
much.
treat it to make
Even
sure.
some chips.
Yes. So if they need medication, of course, and it's not like, oh, it's going to, yes, they can, sometimes the stimulants, they can affect their growth, but none of
Compared
the
to
kids,
so
none of the
looking at
kids
the
I have, had that issue that I have treated.
Pros and cons. Look, yesterday I had a client that the parent was saying that I think he needs medication. Then I'm inquiring about it. The child already has 3 felonies: vandalism, owning a gun, drinking alcohol, and the child is 15. And I'm talking to the mother. I said, look, she said the only reason he's not in prison is because he's underage with 3 felonies. I said, don't you think it's time for you to take him to a psychiatrist to get some medication?
Correct.
Because this child is suffering. Started from oppositional defiant. They didn't pay attention. Got into conduct disorder right now. Problem with law, teachers, expulsion from school, 3 schools. And I said, if you don't stop it in a couple of years, then he's going to really be behind bars.
Correct. You probably have seen so many age 18, they just walk in because now they're 18. And enough is enough.
Yep.
I throughout high school, I suffered. This is what's going on. I want to get help now.
And parents, they're not supportive. I even actually say this, that I saw somebody, the child, the guy, 17 something, very smart. He said, I want support. My parents were against it. He was a month short of 18. I said, you know what? We're going to test you as an 18-year-old, because then you don't need, for ADHD, you don't need your parents and teachers' input. You're smart. I can see you're motivated. We're going to wait for a month. You're officially 18. We're going to treat you as an adult because you're the one who wants to help yourself. While the parents were so much a stigma, they didn't want the child, oh my God, my child is on, medication. So a lot of times the story is the opposite. The child is, the person is more interested. The parents are so afraid.
No, so many, when they turn 18, I've seen many people coming in for different mental health conditions, ADHD, anxiety, or depression. Especially if it starts young age, we need to pay more attention to treat it as early as possible so we can help them to be successful like anybody else. I have so many patients that I know them since they were in high school. They're attorneys now. There's doctors I have. We know each other for a long time, and 10 years, 11 years is a long time. And I'm watching their progress, and it's not like none of them are addicted to anything. They're all successful, highly educated, family, kids. And there's a way of using any medication. When you come in for any treatment, we're going to tell you how much you have to use. Like, for example, ADHD doesn't mean these kids are going to be 24/7 medicated. If we use stimulants, a lot of times we use non-stimulants. And even if we use the stimulants, there's a way of using stimulants. And we have to educate the parents and the child. What is the expectation of the treatment? And most of them, they're not on medication on the weekends. They're not on medication on the summertime. Yeah. Summertime's all my kids, if they're on the stimulants, everybody's off. And I make it clear, day one with the parents, this is going to be the treatment plan, and this is what we're going to do. If you're on board, we do it. But if they push, I've had, contrary, some parents are actually pushing too much for the stimulants.
And they want the child quiet and calm.
They wanted, like I remember one mother, she was just every time, well, if he's not taking medication at home on the weekends, I don't want to deal with him. She actually seemed to be giving the medication more on the weekends and holidays than when he was going to school. I said, like, you did the opposite here. So, yes, or some of them actually, we're in Orange County, there's a lot of competition at schools, and I see some parents that they give a stimulant in the morning, and then 4 o'clock, 5 o'clock, they come home. They still want to give them another dose to do homework or attend extracurricular activities to last until 9 p.m., 10 p.m. I'm against that.
Yeah.
I said, give his brain a break. I mean, you're pushing too much. You want to give every day. No, the previous psychiatrist. I said, well, you can go back to the previous psychiatrist, but I think it's too much stimulants, not good at a young age.
Yeah.
And there should be a limit. He's just only, or she's just 14. You're acting like he's a brain surgeon here, 24/7 has to work. You're not giving their body a break. You're on the weekend, you keep giving it to them. This is not going to work out. We need to get the child off the medication, or I'm not going to prescribe it, or you do it this way. Don't ask me for more and more and more. Sometimes it's opposite. They want more and more for these kids, and we say, no, that's not going to happen. I mean, they're kids. Let them be a kid. They're playful. It's like a 7, 8-year-old boy running around. If you do the ADHD testing on all the boys at school, maybe 70% of them are going to be positive.
Yeah, and these days, I guess, because the use of technology at young age, the brains are a lot more activated earlier on,
Correct.
stimulated so much
Correct.
that anything else looks boring. So we have advancements in, and we have to update our assessments. But look, this is very informative. I really am appreciative of all the vast knowledge and information you brought along with your kind and fun. It's always a pleasure talking to you, and I hope you come back again and just bring your vast knowledge and your great personality here.
Thank you.
We can't get enough of you, absolutely, but I know your time is limited. So is there anything else that you would like to add that you think that we should add to this episode?
I just want the general public to know, don't ignore if you're having, even if something may not be a big deal, but when you see, especially when people are around you, they're telling you, pay attention to your health. Your health, when I say I look as a person as a whole, doesn't matter what it is, but especially mental health, we have to pay attention to our mental health and well-being. And if there is some issues, you don't have to take medication. We're not going to go overboard. All you can do, go see a specialist, go see some expert like yourself, and just have a conversation. If you see a therapist, it doesn't mean they're not going to put you to sleep. Or it's just having a regular conversation. Let them talk to you. Let them evaluate you, see if you need any medication, if you need any therapy, and always be open to it. Doing therapies like exercising. You're just trying to, and it's a part that it is with all the treatments we have. I always give an example to people. I say, if you have a broken leg, we fix it, we do surgery. If you don't do physical therapy, that's not going to go back to normal. So that is a must. It's not like, oh, it's a choice. It's a must. You have to combine it and do those things so that you don't rely only on one thing. And please take care of yourself.
Dr. Nikoo, thank you so much for all that you're doing for our community.
Thank you.
All the great services, and hopefully we get to see you back here soon.
Definitely. And thank you so much for all your help and support. We
My
appreciate
pleasure.
you.
Thank you.